Hello and welcome. When we do a hypothesis test, we are adjudicating between the null hypothesis and the alternative hypothesis. We are making a judgment about which of those hypotheses is more likely to be true. But when we do this, we're not guaranteed to get the right answer. There's always some room for error. When we do our hypothesis test, there are two scenarios where we make the right decision. The scenario where the null hypothesis is true, and our decision is to stick with the null hypothesis, to fail to reject it, and the scenario where the alternative hypothesis is true, and we reject the null hypothesis in favor of the alternative. So how about ways that we can make decision errors? If the null hypothesis is true and we reject the null, we've made what's called a type 1 error. This means that we've decided that the alternative hypothesis is more likely to be true than the null hypothesis, but we're wrong about that. The null hypothesis is actually the true representation of reality. For example, if we were doing a pharmaceutical trial, our null hypothesis would be that the drug that we're testing is no more effective than a placebo. If in reality that's true, that the drug that we're testing isn't effective compared to a placebo, but the conclusion of our study was that the drug was effective and was a good treatment, we would be committing a type 1 error. The reality would be that the drug is not effective compared to a placebo, but our conclusion would be that the drug is effective, and that would be wrong. A type 2 error is the opposite scenario, where the alternative hypothesis is true, but we fail to reject the null hypothesis. We stick with the null hypothesis, even though the alternative hypothesis is the better representation of reality. So to return to our pharmaceutical trial example, this would be a situation in which a drug is effective compared to a placebo in reality, but our study concludes that there's no meaningful difference between the drug and the placebo in terms of effectiveness. So we would wrongly conclude that the drug is ineffective compared to a placebo, when in reality that drug would be an effective treatment. So let's explore this a little further by thinking about a hypothesis test like a criminal trial. In this situation, the null hypothesis is that the defendant is innocent. Our starting assumption is that the defendant is innocent until proven guilty. So the alternative hypothesis is that the defendant is guilty. So if we declare the defendant not guilty when the defendant actually is guilty, what kind of error is that? And if we declared the defendant guilty when the defendant was in fact innocent, what kind of error would that be? Pause the video for a sec and try and figure that out. So if we declare the defendant not guilty when they are actually guilty, what we're doing is we are failing to reject the null hypothesis. We're sticking with the null hypothesis of innocence when in fact the alternative is true. The defendant actually was guilty. That's a type 2 error. In the other scenario, where we declare the defendant guilty when they're actually innocent, we are wrongly rejecting the null hypothesis of innocence in favor of the alternative hypothesis of guilt, which is a type 1 error. So, as I'm sure you've noticed, how cautious we are about rejecting the null hypothesis versus how ready we are to accept the alternative hypothesis determines what kind of error we're more likely to make. So we might want to know what type of error is worse, what sort of decision rule would be better for us. The answer to that question really depends on what the problem that you're trying to solve is, what your context is. So for example, when it comes to legal trials, the English jurist Sir William Blackstone, who lived in the 1700s, famously wrote that it was better for 10 guilty persons to escape than that one innocent person suffer. So his position is that the type 1 error, a wrongful conviction of an innocent person, is much worse than a type 2 error, a mistaken acquittal of a guilty person. So in this context, the traditional rule of thumb in legal trials is that type 1 errors are worse to make. If we switch our focus to a medical context where we're testing to see if a patient has a particular condition, our null hypothesis is that the patient is fine and does not have the condition, and our alternative hypothesis is that the patient does have this condition. In this case, a type 1 error is a false positive, where the patient in reality does not have this condition, but the test says that they do. And a type 2 error is a false negative, where the patient does in reality have the condition, but the test tells them that they're fine and that they don't have it. In this context, a type 2 error is usually seen as worse. It is worse to tell a sick patient that they're healthy than to tell a healthy patient that they're sick. A common rule of thumb in research is to reject the null hypothesis when the p-value is less than 0.05. So that means that there is less than a 5% chance of observing a value as extreme or more extreme than the value we observed if the null hypothesis is true. So that's a significance level, or an alpha, of 0.05. And what that means related to decision errors is that we don't want to wrongly reject the null hypothesis more than 5% of the time. So when we use the 0.05 significance level, we accept about a 5% risk of making a type 1 error if the null hypothesis is true. So the probability of a type 1 error is equal to alpha. It's worth noting that this rule of thumb, this threshold of 0.05, is arbitrary. There's no reason why our standard wouldn't be 0.04 or 0.06, but 0.05 is just something that is commonly and traditionally used. There's a trade-off between the likelihood of type 1 and type 2 errors, and we adjust our significance level, the alpha value that we use, depending on the relative cost of a type 1 error versus a type 2 error. So the lower our significance level is, the more protected we are from type 1 errors, but the more likely we are to make type 2 errors. So the lower our alpha is, the less likely we are to reject the null hypothesis, and that means that we're not likely to make a type 1 error of wrongly rejecting the null hypothesis, but we are exposing ourselves to more type 2 errors where we should reject the null hypothesis, but we don't. So depending on our application, depending on the errors that we most want to avoid, we can adjust our significance level to reflect our judgment call about the trade-off between type 1 and type 2 errors. If we really want to minimize type 1 errors, if we're really concerned about wrongly rejecting the null hypothesis, we can choose a really small significance level, like an alpha of 0.01, and be really cautious. If we want to minimize type 2 errors, we should choose a higher significance level, and in this case, we minimize our chances of wrongly sticking with the null hypothesis when the alternative hypothesis is true. If we don't really have a preference for whether a type 1 error or a type 2 error is more likely, then you might just stick with our rule of thumb of an alpha of 0.05. So that's been our lecture on type 1 and type 2 decision errors. There is a good discussion of this in your textbook, which you should check out. And if the concepts are continuing to be unclear, there are lots of online resources with examples of type 1 and type 2 errors, which should help illuminate which error is which, and help you decide which of those errors you might want to avoid in your particular application. Thank you for listening, and I will see you next time.